Good evening. Here we meet again in yet another episode of BMC Global Live AL-HILAL Health World, nothing but lifestyle. I am Jesila Mujib, your host for today. Embracing a healthy lifestyle at any age can help you lower the risk of heart diseases. Today we are going to discuss about heart diseases, and we are delighted to have with us Dr. Abdul Khadir from AlHilal Hospital, Manama. He is a consultant cardiologist, and let's welcome the doctor to the show. So doctor, welcome to the show, and we appreciate you being here joining us today.
Thank you.
So doctor, before we move on to the topic, I would like to know more about the services you offer at AlHilal Manama, especially in your department.
Yes. So here in AlHilal Hospital in Manama, we have many departments, starting from internal medicine. We have all the departments, and I'm in the department of cardiology. So here we are able to focus on patients who have diabetes, hypertension, high cholesterol, who are at risk for heart disease, and also the patients who come with varying symptoms where we have a doubt that they might have a heart disease. So we do so many tests to find out whether they have some significant problem, and based on that we treat them and for follow-up and maintenance. So we have so many facilities here. So based on that, we are able to pick up so many diseases in an earlier stage. So this helps to save the health of so many patients, and we have multiple departments here: gynecology, internal medicine, pediatrics, cardiology. So this is in one umbrella. Under one umbrella, you have so many facilities here. So in our department, we have facilities like electrocardiogram, ECG, echocardiogram, stress testing, and we also have a lot more variety of blood tests which can pick up heart attack or people who have a risk for heart failure, and whether to find out about their sugar status and blood pressure, and whether any damage is happening in the body because of these diseases. All the tests we are able to do. We have all scans, ultrasound, and we have facilities for CT scan, MRI. These things are also there. So we have all the branches are there. So all the branches are interlinked. So for few tests, if we have to send to another branch, that also we are able to do. And ultimately the goal is to give happiness to the patient.
Yes.
So to relieve their stress, anxiety and symptoms, and to have a healthy life for them.
So what are the risk factors for coronary artery disease?
Yes, ma'am. So for coronary artery disease, we need to know what is coronary. So this is the model of the heart, human heart. So here, this is the biggest chamber of the heart. We call it left ventricle. So this chamber will have blood. Here this will be pumped, and this will go through the big pipe here. This we call as aorta. So this pipe carries pure oxygenated blood to all over the body. So the blood inside in this chamber will not give 100% oxygen to the muscles here. See, this muscle also needs oxygen. Okay. So for the muscles here to pump properly, we need 100% oxygen flow. The oxygen here for the muscles, this oxygen will come only from the branches arising from the big pipe. This big pipe will give the red color ones. When you see the red branches come from this big pipe, these red color branches are called coronaries. So they carry oxygenated blood. The blood gets pumped from here, it goes into the big pipe, and from the big pipe, the small red pipes take blood to the heart muscle. So these pipes are called coronaries. Okay. These coronaries, they can develop blocks. Generally from the middle age, people start developing blocks if they don't take care of their health. Sedentary lifestyle, too much stress, tension, or smoking, and high cholesterol, high blood pressure, so many things, and even genetic factors. All these lead to blocks or the occlusion in the pipes. So once the occlusion starts, sometimes it will start gradually, little by little. Every year, some 10-20% will increase. So beyond a point when the occlusion goes more than 50 to 70%, patients will develop symptoms. Once they develop symptoms, generally they come to us. So at that time, we have so many tests which can pick up the blocks. So this is the coronary artery, and the blocks which occur inside that we call as coronary artery disease. So we have risk factors for coronary artery disease which we call as modifiable and non-modifiable. Modifiable is diabetes. See, you can try to prevent diabetes. Even if someone who has a genetic risk for diabetes, with healthy lifestyle, proper follow-up checkup, you can at least push it away. Instead of someone having diabetes at maybe 30 or 40 years of age, you can push it to 50 or 60 years of age. So that itself is a great achievement. So, and hypertension, high cholesterol, all these things are modifiable. Smoking, you can avoid smoking, all that. And there are something called non-modifiable. For example, age. Age you cannot change. As we age, we will have that risk for blocks. And one is genetic susceptibility. You might have seen some people, they might have very bad, unhealthy lifestyle, but still they will be healthy for 80 or 90 years. They might be smoking, they might be fat, they might have diabetes, hypertension. And we also see people who are young, 30 to 40, they don't have smoking, no alcohol, no diabetes, hypertension, but still they'll end up with heart disease. So there is a component called genetic susceptibility, genetic risk is there. For example, if one or both the parents or a large number of family members have heart problems, there is a chance for the other people also to have. So all the other members of the family should take care, extra care, and they should focus on their health. So these are modifiable and non-modifiable risk factors.
So doctor, we often hear about heart failure. Now what is the difference between a heart attack and a heart failure?
Correct.
And also please mention the symptoms.
Yes. So the heart attack is in these pipes, when you develop sudden blockage, then the oxygen to the heart muscle is lost. So once, see, the heart is the organ which is active from day one of life to the last day of life. There is no holiday for heart, no Sunday, no vacation. So the heart never complains. So heart is such a good organ which is always on your side, supporting you. But many people, they don't realize the value of the heart until they lose the health. So the heart, when we get a blockage in the coronaries, we call it heart attack. And usually we have two types. One is people will develop the blocks slowly, little by little, over a period of months to years. That we call a stable coronary disease. So it will gradually increase. The other is unstable. Unstable is the block inside the pipe is, it is a dynamic thing. Suddenly the block will become more, sometimes the block will be less. The blocks is like a volcano inside the pipes. Suddenly the volcano erupts and the fatty material comes and occludes the pipe, and again the blood will break the clot. So there is some kind of unstable nature of the disease. So that is why you see patients, all of a sudden they will develop chest pain. For so many years they will be okay. Suddenly within a period of 1 month or maybe 2 weeks, they will suddenly develop chest pain which will be so severe and they will come to us. That is called unstable coronary syndromes. So two types of heart problems. One is which is stable and gradually it comes, gradually it increases over a period of months or years. One is suddenly it starts. There are two types. So that is called coronary artery disease. So once you have a blockage, then the oxygen supply to the muscle is less. So it depends on the severity. So if the block is coming, the heart will try to adjust with whatever oxygen is coming. The heart will think, okay, the oxygen is not coming, so I will try my best. So the heart tries to cope up. But sometimes if the oxygen goes below a critical point, then the muscle power will start coming down. That we call as heart failure. So in heart failure, the muscle here will not be able to pump. So the heart muscle has to pump in a powerful manner. So for each and every heartbeat, the heart is like a muscle bag. The current will pass once. Once the current passes, the heart will pump, and once the heart pumps, you will feel the pulse. So, it is like a current, heartbeat, pulse. This sequence will be there for every heartbeat. So, as the oxygen supply to the heart muscle is less, the pumping power will become less. So, at that time, the people will develop symptoms. See, for heart attack, the symptoms will be commonly chest pain. Chest pain, usually it is not like a pinpoint pain. Normally, it is very rare to have chest pain due to heart attack as a single point. Usually, it is diffuse. It is generalized chest pain, sometimes in the upper part of the stomach or in the back, neck pain or jaw pain, shoulder pain. So, the pain can radiate to the arm, left arm, sometimes to the right shoulder, to the right arm also, and back pain. So, these are the, and breathlessness, they will have breathing difficulty. So, these are all the symptoms of heart disease. People can rarely have too much of burping and sometimes vomiting, giddiness, loss of consciousness. So, the list just goes on. And so, once they develop symptoms, people should not think, okay, this could be some non-specific problem or it's because of weakness or due to gastric problem. So, we need to have extra bit of caution. So, we see so many people, they have gastric problem for so many years, and suddenly when they develop heart problem, they get fooled by their own symptoms. They think, okay, this gastric problem is there for so long. So, they lose 1 or 2 days. After that crucial time is lost, the heart pumping will become slow. Then later on, they will go into heart failure. So, we have, we call as time is muscle. The more time you are able to save, the more of the heart's energy will save, and you will save the heart from damage. So, we need to, whenever you develop some symptoms in the chest, some form of giddiness, palpitation, chest pain, breathing difficulty, it is best you come to the doctor as early as possible. So, for heart failure, all these symptoms can be there. The most predominant thing will be breathlessness. Usually, the patient will tell doctor, all these days I was doing my routine activities. Now, for the few days, I am not able to do my routine activities. I feel more breathless. Or while speaking, they cannot speak continuously for maybe half to 1 minute. They will feel breathless. Okay. They will have the need to break the sentence, get some air, get some breathing, and then they will be able to speak. Or the leg swelling will come, swelling of both the legs, and too much of fatigue, tiredness, and the appetite might be lost. They will not feel hungry. The abdomen will be in a bloated or distended abdomen will be there. So, so many symptoms can come. So, after the COVID pandemic, we had the first and second waves, and since then we are seeing so many young people landing up with heart problems. So we need to be alert and careful. So, of late we are seeing so many patients. So, once someone has these symptoms, they should come to the doctor at the earliest.
So, doctor, can you share some of your experience as a cardiologist?
Yes. So, recently we had a patient who was 37 years old. He was belonging to the Middle Eastern area. So, this patient, he was a smoker, and in the afternoon time, all of a sudden he developed stomach pain. In the upper part of the stomach, he had pain, epigastric pain, and he was having too much of burping and belching. So, then he came to the hospital, they did an ECG, ECG was normal. But still the doctors felt, okay, this doesn't look like a routine gastric problem. So, they told, okay, you meet with the cardiologist and the doctor will advise you. So, the patient came to my OPD, and initially when I saw the patient, I too had a feeling that it is looking like gastric problem. So, but there was something, we call it gut feeling, no? We have that insight. So, then I did echocardiogram for the patient. So, when I was looking at the heart, in the echo, we will be able to look at the heart like this. When I keep the echo probe on the chest, this type of an image will be there. The image which I showed like this, yeah, this type of an image will be there in the computer, in the echo machine. So, I was able to see. So, most of the areas were normal, but for example, in this type of one area alone, I had some doubt. So, I was constantly digging and I was focusing on that one area, and after about 3 to 5 minutes, I was sure that there is some problem here in one small tiny area. Then I told the patient, now if you go and repeat the ECG, because 1 hour had passed by then. So now if you go and do the ECG, maybe the change might come now. So and I called the emergency team and I told them, repeat the ECG now. So at that time when we repeated, the ECG became positive for heart attack. And the funny part is the patient is not ready to accept. So he's like, I'm young and no, I don't think I have a heart problem. Then luckily the patient's wife was there and she compelled the patient and to go ahead with the further checkup. This patient required a coronary angiogram. And the angiogram was done and it showed 90% blockage in the main pipe. So maybe if he had lost some 2 to 4 hours, so maybe if this patient had lost 2 to 4 hours, then this patient would have landed up with cardiac arrest or he would have just popped off. There's a high risk of dying for people who have 90% blockage in the earlier pipes. That is the origin of the pipes. So the doctors, they called me and told, they sent me the images where the blockage was there and they did stenting. And by God's grace, the patient did well and he was discharged home.
Oh, you were able to save him.
Yeah, by God's grace, the whole team worked. It was nice. It was so happy to feel appreciated and that we are able to save one life.
Really interesting.
Yes. And recently we had one more patient who was 50 years old. He belongs to Southeast Asian population and he was extremely obese patient. 50 years old, obese patient. He has diabetes, hypertension, and this patient had breathing difficulty since 2 to 3 months. So, but still the patient is not able to accept that he has a problem. So, no, I'm able to do my work regularly. Only if I climb the staircase, sometimes I feel little breathless. That's what he told. But the way the patient was walking and coming to the clinic, the way he was speaking, I had a doubt. So I told him, come, we will go through so many tests. And after these tests, I had a strong doubt. I told, no, I have a feeling you have a hidden block inside. So you will have to go for an angiogram test. So this patient, he went for an angiogram test. And again, this patient also had a 90% blockage. See, there is gross difference between the first and second patient. First patient came with severe chest pain. This patient never had any chest pain. He only had some breathing difficulty. So, when this patient went for angiogram, again he had 90% blockage in the origin of the pipe. We call it left main coronary artery. That is the first branch coming from the big pipe. So, there 90% blockage was there. Then they put the stent and the head of the department from that hospital, he called me and he told, thank you doctor, you have saved one life. So, I said, sir, it's a teamwork. We are happy that by God's grace we are able to do this thing, and truly it was very happy. See, imagine this patient, if he did not go for angiogram, obviously we would have never known. Similarly, we had at least 3 or 4 more patients. One was a young guy who was 32 years old. He had typical cardiac chest pain and he was shifted as an emergency basis. He also had a heart, the coronary blockage, and he was stented. And one patient, 3 days back, he came to the OP. 1 month back, I had told him that you seem to have a blockage. You go to your own home country, native place, because he was not affordable to get treated. So he said, I'll go back to my home country. There, they did angiogram. Again, he had 2 blocks. They did stenting, and he came and thanked me, and he told, doctor, I got the stent. And so it is truly a God's gift that we are able to touch the lives of so many people.
Yes,
I am truly thankful to AlHilal Hospital, where we are able to do so many critical tests and catch the person. See, once we lose time, we cannot help. People, so many people, they die during sleep or they die during their job, while walking or during some relaxation, they die. But to save them is such a great gift from God, and I am truly thankful to the AlHilal Hospital management who has given us so many opportunities to save the lives of so many people.
Alhamdulillah. So, another common query among our viewers is, how common is heart diseases among women?
Yes. So, normally what happens is, see, men, things like smoking and alcohol and more stresses, job stress, all these things are more for men. But for women, there is different set of problems. They have stress at home. Though we say Being at home appears as if it is nothing. That is the
cannot say
toughest job. Yes. So the most toughest job on the planet is being a homemaker. So there is no Sunday, there is no holiday, no vacation. 24/7 it is always there. That too, to take care of kids. It is such a big, huge task, and the stress, mental load on the brain is too much. All this adds up. Women have in the reproductive age, women in the age group like 20 to 40, around 20 to 50s, they have a protection by the hormones. They have the female hormones inside the body which gives a protection for the heart. So, in the people who are around 20 to 50 years of age, they have lesser chances of heart attack. But of late we are seeing that the protection is given by the hormones, but due to sedentary lifestyle, due to increased incidence of diabetes, hypertension, cholesterol, women also have seemed to come closer to men in the race towards heart diseases. But after the menopause, women have almost equal or a bit slightly higher kind of almost equal, you can say almost equal risk, which is equal to that of men. So, in the middle-aged reproductive age group, women generally have a little safety margin because of female hormones, but once they cross the menopause, then the risk is almost the same. So, but the problem is for women, they might have atypical symptoms. They may not have the typical chest pain. They might have some breathing difficulty, some burping, some stomach pain or back pain. So, many times easily the doctors will have so much trouble and difficulty to catch the problem. So, whenever the female patient comes, we will be all the more alert because we should not miss any blockage. So, this is one small glitch between men and women, but once they cross menopause, then the risk is the same.
Okay. Now, what are the precautions to be taken by a person after heart attack to lead a normal life?
Correct. So, heart attack, maybe 20-30 years back, it used to be like a dangerous word. So, everyone used to panic, and the medicines were also very less, and we didn't have so much of science to back us up. So, now we have so much of facilities, and the treatments and all modalities have improved. So, the quality of life has improved dramatically compared to 30 years back. Now, we have so many good medicines, tests and all lifestyle changes we have found. So, heart attack does not mean the end of life. It only means one different chapter of life is there. So, first and foremost, after heart attack, the person should regularly take medicines. They should not skip medicines. Skipping medicines even for one day can bring back the block. It is so dangerous. People know, oh, it's just one dose I have missed. No, even missing one dose can create a big problem. Normally, we place stents inside the heart to keep the pipe open. See, once the blockage is there, the pipe is closed. So, what we do is we clean the pipe. We keep a pen spring kind of material inside, which is like a pen spring. We call it stent. The stent is inside. It is keeping the artery open. It will not allow the artery to close back. The stent should not close. So, once if we take the medicines regularly, they are called blood thinners. Blood thinner will keep the blood thin. It will not allow the blood to clot. So, we can prevent clotting of the blood into the pipe and blocking of the stent. But if they miss the tablet, then the blood clot can go and clot the stent, and it is like new heart attack. And that will not give you more time. Instantly, the stent can get closed. Even by the time patient goes to the hospital, suddenly they can land up in trouble. So, we need to be careful about medicines. And the post, like life after heart attack, one is medicines and then diet. We have to follow strict diet. You cannot go back to your old lifestyle. You have to cut down on red meat and oily fried food, junk food, all these things we will have to avoid. Fresh fruits, vegetables, fruits that are not very sweet, something like green apple or unripe papaya, unripe banana, those things we can cut, cook and eat. And pomegranate, which is not sweet, and strawberry, these kind of fruits, they are not unripe guava, they are all sweet, fruits that are not sweet. Just because doctor told eat fruits, people should not go take jackfruit, mango, then the thing will get spoiled. So one is dieting, and walking is compulsory. Every day they should walk at least for half an hour to 1 hour, so that the circulation is maintained. People who walk regularly, 99% of time they will be able to avoid heart attacks. And the best benefit in walking is when they walk regularly. So in case new blocks are coming in the heart in future, they will be able to feel the chest pain while walking. So typically the patient will come and tell, doctor, all these days I was walking, there was no chest pain, but now off late since 2 weeks, 1 month or 2 months, now I am developing chest pain while I am walking. At that time we will become alert. So we will check up, you can prevent a sudden heart attack. We can do checkup, test and see whether blockage is forming. So accordingly you can save them. So this is one. And stress tension should not be there, and sleep should be adequate, and these are the things they have to follow. So life after heart attack is not a very much of a change, but more changing towards healthy lifestyle. And one main thing is, while passing for stools for defecation, patient should not strain. If they strain while passing toilet, the chest pressure will shoot up. That itself can lead on to sudden overload on the heart. So heart can fail suddenly, patients can collapse and die also. Many patients typically after heart attack, when they are inside the hospital itself, we will never allow them to go to the toilet. We will give them a bedside commode, or we give them a bedpan. We will ask them to pass stools. But if they feel uncomfortable, they will compel saying that they want to go to the toilet only. But we will warn them clearly, never strain. If the toilet you are not able to pass, we will give some medicine so that you are passing freely. Because all over the world, so many people die in the toilet only. Because they strain while passing toilet, then they will become unconscious, that's all, they will land up in trouble. So this thing we can avoid. So these are the few steps which will help after the heart attack, and regular follow-up and check-up.
So doctor, before we wrap up, what do you have to say about AlHilal Healthcare?
Yes. So I am extremely thankful to God Almighty, because this is such a nice center where they have all the facilities which are required to pick up the problems at an earlier stage. And we have all blood test, ECG, echo and stress test, and we have Holter monitoring, we have ambulatory BP checkup, and we have CT scans, MRI, you name it, it is there. So truly it is God's gift, I must say, and I am extremely thankful to the management, because they are always on the edge to help the patients. So these are one of the very few hospitals which are truly dedicated for the patients, and it's a great honor to work as a team here. It's a teamwork. If I'm not there, there will be other people to take care of the patient. So truly it is, I'm very happy and thankful to God, and I pray that they continue their service, and we have seen so many lives being transformed in a better manner, saving so many lives. So I'm very happy, and I'm sure this good service will go on for a long time, and I'm thankful to God for that.
And doctor, finally, what is your advice for our viewers?
Yes, the one advice which I would like to give is, health is wealth. There is once we lose health, we cannot gain back the health 100% what was there before. So we can afford to lose money, because you can earn money again, but you can never earn back health again. So my advice is, regular dieting and walking should be there, and avoid smoking, and follow all healthy lifestyle, regular follow-up, checkup, and avoid a stress-free life. And these are the advice I would like to give them, because now this is an era where all of us are addicted to either TV or mobile phone or all these addictions. People become sedentary, and as a result they'll end up with diabetes, hypertension, cholesterol, heart disease, all of these things at an earlier age. Previously 60, 70 years was normal. Now 30, 40 has become the age for cardiac problems. So I would sincerely suggest to my viewers that to take care of health is the prime priority of utmost importance, and regular dieting, walking will add on to your healthy lifestyle, and this will save you from lots of stress in future. Yes.
Thank you, doctor. Thank you for joining us. and giving us such a lot of information about heart diseases. Thank you once again.
Thank you.
So, viewers, I hope this was a very informative episode. As doctor said, we know the value of health only if it is lost. So, take care of your health, be happy, be healthy always, and till we meet again next time, this is Jasila Mujib signing off. Good night.